Welcome to this special episode of The Switch. My name is Jake Burleski, Marketing Communication Associate at Nonprofit HR. I am so excited about today's episode, where we're going to hear from 4 women named to Nonprofit HR's 2024 Social Impact Women to Watch list. Each year during Women's History Month, Nonprofit HR is proud to recognize women across North America who have made significant contributions to nonprofits, associations, foundations, social enterprises, and the communities that they serve. This year, our Social Impact Women to Watch series features panel interviews with the 25 finalists named to this year's list. On today's episode, you will hear from Dr. Ruth Browne, Morgan Monaco, Deb Kelsey, and Dr. Ann Barnes. They will be interviewed by Lindsey Otto, Marketing and Communication Specialist at Nonprofit HR. And now, a little bit about our guests. Dr. Ruth Browne is the president and CEO of Ronald McDonald House, New York, which provides support and services to families battling pediatric cancer and other serious illnesses. She is also a nationally recognized, highly accomplished leader, business innovator, author, and strategic advocate for value creation in health and education. Morgan Monaco is the president of Prospect Park Alliance and the Prospect Park Administrator. A born and raised New Yorker, Monaco leads a workforce of more than 200 Alliance and New York City Park staff and oversees fundraising and revenue-generating activities that provide $14 million in general operating support each year. Deb Kelsey wasn't born into a fishing family, but became part of one in 2009. Now, she is a recovery coach and navigator at Fishing Partnership Support Services, where she takes action to help others improve the health, safety, and economic security of commercial fishermen. Dr. Ann Barnes is president and CEO of Episcopal Health Foundation. In this position, and throughout her career, Dr. Barnes has led innovative care solutions that go beyond the doctor's office to tackle social, economic, and environmental drivers of health. You're going to love this episode, and I welcome you to share it in your communities. You can find this recording at nonprofithr.com/The Switch. Without further ado, let's dive into the conversation.
Hi, everyone. Welcome. Thank you so much for joining me on the show today. Each of you are changing lives in your respective missions, but also just as women in the work that you're doing every day as well. It's such an honor to host this panel. Before we jump into our conversation, I would love it if each of you could introduce yourself to our listeners and share what it means to you to be named a Nonprofit HR Social Impact Woman to Watch this year. Whoever wants to jump in first, feel free.
I'm happy to. Thank you, Lindsey. I'm Morgan Monaco. I'm the president of the Prospect Park Alliance. We are the nonprofit that works in partnership with the city of New York to take care of Brooklyn's backyard, known as Prospect Park. I'm a born and raised New Yorker. I have a lot of love for my city, and I've spent my career working both for the government, for the city, as well as for nonprofits. So my background and experience is in public-private partnerships. So I'm excited to dive into what that looks like and the different perspectives from being on the nonprofit side and then being on the government side. And I'm just delighted to be a finalist because I got my start with somebody recognizing the talent that I had when I started out as an intern when I was 18 years old. I'm sitting in this chair today because I had women who influenced my leadership path. So if I could pay that forward with other women to see, especially being a Black woman in the open space sector where you don't see that very often. So I am excited to be an inspiration to other women to pursue their passion to care for our environment. So thanks for having me.
Thank you, Morgan.
I'll jump in. Hi, I'm Ruth Browne, President and CEO of Ronald McDonald House, New York. And I'm thrilled to be a part of this panel, thrilled to meet the other women on this panel and to be named a woman to watch. Not only very flattered about the recognition, but also I think that this recognition speaks volumes about the work of Ronald McDonald House, New York, and the impact our organizations work has been having. And so we're celebrating our 45th anniversary this year and even more committed to advancing health equity among the city's most vulnerable population, as well as those we serve around the U.S. and around the world. So thank you for having me.
Congratulations, Dr. Browne. Thank you.
I'm happy to go next. My name is Ann Barnes, and I'm the president and CEO of Episcopal Health Foundation. We're based in Houston, Texas, but our work covers 80 counties across the state. I am a native Houstonian and a physician by training, and so health has always been important to me in my career, and it's a delight to be able to work in an organization that prioritizes equity by addressing health and not just health care, because we know that the majority of a person's health exists and is influenced by things outside of the doctor's office. I'm really humbled to be a finalist, and like the other women on this call, I know we don't do this work to be acknowledged, but I do appreciate the opportunity to elevate important issues, and the recognition allows me to do that. So thank you.
Thank you, Dr. Browne. That's bring us home.
So I'm Deb Kelsey. I'm a health insurance navigator, a community health worker, and recovery coach for the Fishing Partnership Support Services. We are a nonprofit that promotes the health, safety, and economic stability of commercial fishing families. I am the best catch of a commercial fisherman myself. I understand the inequities and the lack of access for many services for our community. I'm proud to represent our community and to be a bridge to help gap those inequities. I am certainly humbled and honored to be recognized as a woman of impact, and so I'm grateful to be here. And I'm grateful to be amongst all of these amazing women who are also making impact in their communities and beyond. So thank you.
Thank you so much, Deb, and everyone. I would love to dive into the conversation today and know what drew each of you to your organization's mission, individual mission, and to the social impact space in general.
So for me, it was our mission of improving health and safety and economic stability to fishing families. So applied to me as I am a fishing family. And it was an opportunity to bring forward the inequities that my family was facing along with all the other families that were facing these challenges. And so it was very easy for me to come to Fishing Partnership and be an advocate and to realize that services need to be brought down to the waterfront for our commercial fishermen to access those services. They have schedules that are not in line with the rest of our community or with what providers normally can provide. So it was an opportunity to share with fellow organizations the needs that were on the waterfront and to build collaboration and partners who wanted to address those inequities. So it certainly felt totally in line for me to be a navigator at Fishing Partnership and to help advocate for our families.
I'll jump in. I come from a family that has worked in the social impact space intergenerationally and really developed a passion for it early on because of that. My grandmother was New York's highest ranking official in the Department of Housing and Urban Development, leading the city's anti-poverty programs under then Mayor John Lindsey, and even more remarkable as a Black woman at that time to be in that position to allocate all the resources and the expenditures for the anti-poverty programs was quite a big deal. And then my mother also directed community development for Bed-Stuy Restoration Corporation as I was growing up. But there are many others, and particularly women really kind of molded me in terms of wanting to be in the social impact space. And I think that, coming full forward, it really being a part of the Ronald McDonald House really fulfills my desires to make an impact. I've always been committed to equity, social equity, and have spent most of my career in the health equity field. And the opportunity is about realizing unrealized potential for the organization to do even more after a 45-year history of being successful in serving vulnerable children and families who have serious medical complex illnesses.
I'm happy to go next. As a physician, I have always worked in safety net healthcare systems. And so those are healthcare systems that serve individuals with low incomes, many of whom are uninsured. And through my practice, I really grew to appreciate the immense disease burden and lost potential of life that existed in the populations that I had the honor of serving. I was drawn to Episcopal Health Foundation because of their focus not only in health equity and addressing all of the community circumstances that influence a person's health, but also focusing primarily on individuals who have fewer resources and greater barriers to health. So very aligned with what I learned from my patients in medical care and where my heart and passion were. Also, in thinking about sort of why now, I had been working as an administrator in a hospital system during COVID. And sadly, I watched a lot of communities of color, low-income communities come into the hospital with severe disease and being more likely to die from the disease. And I realized that I didn't want to be on the downstream end of health, taking care of people when they were sick. I really wanted to be upstream, where we focus on prevention and increasing the opportunities for people to live a healthy life. So feels very consistent with what I care about and the people I care about.
I have been drawn to the Prospect Park Alliance because I was deeply influenced by parks and open space throughout my childhood. I was fortunate to grow up in Manhattan, and I had access to Central Park as my front yard. And I spent many hours, years in its playgrounds and fostered a very deep connection to nature just because of my access to Central Park. And, I had previously, before coming to the Alliance, ran a youth and community development organization focused on supporting the 6,500 residents in Red Hook Houses, which is Brooklyn's largest public housing complex. And when I decided to join the Alliance last year, I was very influenced, similar to what Dr. Barnes said, about the impact the pandemic has had, kind of shining a light on these disparities for low-income and BIPOC communities not having adequate access to a quality healthcare delivery system. I arrived at the Alliance with a specific vision of bringing health and wellness services to the park, because already parks are destinations for healing and for active recreation, having, a place for a bike ride or a run or just a basic walk or sitting on a park bench has really beneficial impact for, lowering blood pressure. But what if, by virtue of partnering with the array of wonderful social service providers who are just a couple blocks away from the park and having them come and offer some basic services to the park, could we help sort of bridge that gap for people getting connected to clinical care back into the communities? I feel as though parks and open spaces are not just a nice to have. They're not just a luxury. They are essential parts of what makes a city livable. And I am so fortunate to be in this position now, again, coming out of the pandemic, where there is a greater appreciation for the role that parks and open spaces play in our society, in our world, and to be able to be at the fulcrum of forging partnerships with social service providers to try to reach people who've sort of fallen out of or dropped out of care as a result of the pandemic. So it's a really exciting time to be in the parks and open spaces and adjacent to social services.
Wow, thank you all so much for sharing your personal connections to your missions and how you sort of brought those experiences to your organizations and to the work that you're doing. I'm hearing how everyone is in their respective missions sort of addressing health inequities. And so I love that we have that kind of theme here today, that sort of overlap between you all in different ways in your communities. I want to talk about your leadership and in your organizations and what your people management philosophy is for engaging mission-driven talent.
I'm happy to start. I've been really fortunate to have a number of positive female mentors throughout my life, and all of them have helped to offer me a seat at the table. So I think my philosophy has often been to identify what people are passionate about, what gets them out of bed in the morning, and help to provide a path or kind of open doors for them to explore that further. So if I can be in a position to provide access for someone on my team to learn something that they're really interested in learning about, I'm going to do that. Or help to connect them to somebody outside of our organization that they really want to learn about or pursue, I'm going to do that. I see that as my job, to work with folks for the time that I have them with, but also to support them in their long-term career. So yeah, my approach has been working with people to find what really sparks their passion and their interest, and then getting out of the way for them to pursue that and helping them get there.
I agree 100%. And I would just say that our organizations are as good as the people who run them and work on the ground every day, and the leadership. And, the most powerful tool we have is our mission and impact. And so it's really important to keep our people focused on the mission and inspired by the impact, by celebrating the wins, right? And sometimes we don't take the time to celebrate the wins. We're so in it. And so setting clear goals and targets in combination with great storytelling becomes really important, because that's how we celebrate the wins. And we're really lucky at Ronald McDonald House, because I feel like we're celebrating a win every day. We're celebrating wins just by virtue of the fact that, we have sick kids whose families are in crisis, and every day of that journey, regardless of the outcome, is a win. And our goal is to really make sure that we are nurturing those wins. And so beyond that, I think, when we take care of our team members, right, they show up, they are best for the families and the communities that we serve. And so we focus on creating a culture that fosters engagement. And over the last few years, we've really prioritized building our leadership internally by being even more intentional with professional development and growth for the team members. And, we've been talking about COVID. I think it showed us more and more and more and more how important that is. At the height of COVID, it wasn't clear who was coming to work. And so, when you run an organization that is so dependent on the people who serve the people we intend to benefit from our services, it is critical that we show up for the team as well.
I agree with everything that Morgan and Dr. Browne said. One of the first things I did when I came into my role is I met with each of our team members, and that's about 30 folks in the organization, and let them share with me where their spark and interest in this work came from. And I'll say I learned a lot about them individually. I learned a lot about talents that they possessed that weren't necessarily in their job descriptions, but they were things that really brought them a lot of energy and joy. And so in terms of, leading a team who is filled with mission-driven folks, I see it as an opportunity to listen and learn from them because they have experience and expertise and sometimes lived experience around the issues we're addressing, that it's really in the best interest of me in my role and the organization and our impact to foster opportunities for those perspectives and that passion to come forward. People are the most important asset in our organizations, and fostering and nurturing their passion is key to the work.
So true. And all I can add is that leadership is about collaboration and inspiring others to do their best work.
Yeah, wonderful. Thank you so much. People are the heart of your mission, and they're what's driving it, and they're your most valuable asset as an organization. So I love the emphasis on learning and collaboration and the leadership styles that you all take. Really, really love that. Going from there, how does effective talent management contribute to successful collaboration within your organization? And what strategies do you employ to attract, develop, and retain top talent aligned with sort of that mission-driven approach? Morgan, do you want to start us off on that one?
Yes, I think effective talent management contributes to the outcomes, right? Because it's important, as we were all just talking about, to find people who are passionate about your mission and then to develop them further, and by offering professional development opportunities and especially a clear career trajectory. So I'm fortunate that we have done a lot of work to really transform our HR department. And now it's a kind of flourishing people and culture department who's focused on completely revamping our job descriptions and making it very clear what the career trajectory is available. And we have specific job grades and salary ranges and a criteria to place people within a range. So there's full transparency around compensation. And we also did some market research to make sure that we were competitive with our compensation, and created a program around how staff can socialize with each other and learn from each other through a little program we call Green and Grow. So we invested in just sort of socialization efforts. We'll pick a department and somebody will host for everybody to hear about their latest project, and also just talk to each other and share a meal. So it's the, commitment to having a clear and transparent process for compensation and job responsibilities, where we outline what that growth can be, making sure that we're looking for opportunities for people to learn through professional development is, I think, the best way to, attract and keep really good people.
Thank you so much for that. Dr. Browne, do you want to weigh in on that question?
Sure. I think one of the most important indicators when it comes to successful collaboration is trust. And team members really need to trust one another. And they also need to trust the organizational process. And so how people are rewarded, how goals are set, how we hold people accountable, and how we measure success become even more important as builders of trust. One of the biggest challenges for all organizations right now is how to attract and retain top talent, right? And so it's something we have to be working on every single day. And it's easy to point to the milestone moments and the appreciation activities. And of course, we want to be fair, right, and equitable, but we have to be competitive with our benefits and pay. But it really comes down to the day-to-day experience that our team members are having. And so one of the things that we do are quarterly trainings every year with leaders and other team members, specifically around engagement, right? Surveying the organization a couple of times a year formally, right? While also providing informal opportunities for ongoing discussions on these topics through coffee chats and lunchtime learning series and that kind of thing. And we recently started a peer-to-peer recognition program, really highlighting the day-to-day wins that connect our teams to our values, right? And our values are excellent service, purpose-driven, innovative approach, and compassionate community. And so those things are important. You know, we in the first month of piloting this program, we got 60 submissions from across the organization, and there are 85 employees, with over 40% being submitted by individuals across teams. And so that ability to work across teams and foster that across-team collaboration is really important too. So the program has equipped us with incredible stories to tell and great data that will generate even more discussion internally with team members.
Definitely. I love the emphasis on that learning across different departments. Morgan, you spoke to it with those Green and Grow. I think that's awesome to have a different department showcase, like, this is what we're working on if you didn't know. And it's like, wow, that's really cool. And sort of that peer-to-peer recognition, it all kind of like wraps into it. I love all of that you both shared. I want to hop to our next question, and I want everyone to weigh in on this one. Can you share a specific example, each of you, of a successful collaboration or partnership that has significantly advanced your organization's mission? Deb, do you want to start us off on that one?
Yes, absolutely. I'd like to talk about a collaboration between Fishing Partnership and the United States Coast Guard. So in 2016, when the opioid epidemic, it was affecting all of our communities. Obviously, it affected our industry as well. Fishermen are at a higher rate of maybe needing and being prescribed an opioid because of the work they do, not having sick time. So fishermen are actually dying at 11 times higher rate of an opioid overdose than other workers. So it was a call to action at that point. Back in 2016, we learned that the Coast Guard was not carrying Narcan or naloxone, where first responders on land were carrying Narcan and able to respond to an opioid emergency. But that wasn't the same for our fishermen at sea. So it was like two-part, advocating for the Coast Guard to carry naloxone, which in 2018, they started to carry naloxone. And the second part was to have the Coast Guard back us up with commercial fishermen by creating a marine safety information bulletin that went out to all mariners, asking all mariners to carry naloxone and to learn how to respond to an opioid emergency, as they are finally being recognized as the first responders at sea. And so that collaboration has continued to grow from 2016 to today in 2024, where they've now issued a second marine safety information bulletin. Again, asking mariners to carry naloxone, explaining that they want our fishermen to act as first responders and that they recognize that an opioid emergency can happen anywhere. And it just helps to reduce so much stigma on the waterfront and in the industry by being able to view our fishermen as the first responders at sea, and by also being able to teach community and organizations why our fishermen may be at a higher risk and rate of needing and being prescribed an opioid, which could lead to substance use disorder. And so that collaboration has been huge and has made a huge difference. So grateful for that.
I'm happy to go next. So this collaboration actually predates me and started many years before I joined Episcopal Health Foundation, but I think it's such a good example of establishing relationships before there is a major ask or agenda that allows for the building of trust. 6 years ago, Episcopal Health Foundation reached out to insurance companies that administer Medicaid in Texas. And these are individual companies that are often and competitors, but invited them to the table to sit and talk about things that were pressing issues for each of them. And over time, it was clear that there were several things that they were all dealing with, including the impact of non-medical factors that influence the health of Medicaid beneficiaries. And so there was a lot of talk about what do we do? And over the course of the years, that what do we do conversation has actually influenced the insurance companies and the state agency that oversees them in recognizing the importance of addressing non-medical factors to improve patients' health. And so our mission to work outside of the doctor's office and address those factors has been advanced by that 6-year courtship and collaboration with managed care organizations. And it also offers the promise and the potential that insurance companies may actually begin to pay for some of the services that address those non-medical needs. And so the relationship has moved the mission forward and has also given us the possibility of seeing a sustainable model for that work.
That's amazing. That's so inspirational. I'll add just that my organization, the Prospect Park Alliance, is a public-private partnership. So we work on the idea that it is the city's responsibility to care for its park system. But in the absence of the Parks Department being fully funded, it does take nonprofit and individual neighbors coming together and supporting their local park. But specifically, a recent partnership that we've brought on since I arrived, again, kind of with an emphasis on leaning into how we could be a venue for health and wellness services. We have a partnership with the health department to offer a program called Open Air Connections. And so we're really fortunate. We have community health workers who are stationed in the park and are trained in a protocol to ask people just basic questions about how they're doing, their emotional well-being, but also it takes a social determinants of health perspective. And as Dr. Barnes was saying, if you don't have housing security, if you don't know when your next meal is coming from, if you don't have economic security, job prospects, that contributes to a lower feeling or sense of health and, of course, specific health conditions. So we're hoping to continue to screen folks and make referrals back into the community. I'm really grateful for this initial partnership with the Department of Health, who is also recognizing the importance of meeting patients outside of traditional clinical settings and getting them wherever they can meet them back into care.
Amazing work that you all are doing. I will jump in here and just share that Ronald McDonald House New York is really a feel-good organization. We can tell anecdotal stories about family after family, child after child. One of the things that became really important to us as we launched and started to execute on a strategic growth plan was that we needed to become more of a data-driven organization to demonstrate the quantitative and qualitative impact, the work that we do with families and kids. And so a longtime partner, RBC Capital Markets, been dedicated to Ronald McDonald House for over 30 years now. And they really stepped in to help us accelerate advancing our health equity goals. And those goals really targeted seeing a 30% increase in the number, particularly of New York City families that we would be able to serve in our organization. And so it's an amazing collaboration. They last year made a commitment of $1 million grant to stand up a health equity data center for children and families. And that really is ultimately going to enhance our activities and play an integral role in helping us to achieve that goal of reaching 30% more families each year. And so much of what we do positively impacts medically complex families, but it wouldn't be possible without that kind of support to see those kinds of results in years to come. I highlight that as a partnership because it's allowed us to leverage a goal, but also contributing to accelerating a data-driven culture that we want in our organization.
That's incredible. Thank you all so much for sharing. Just as a follow-up to that question, and all the examples that you all just shared of very monumental partnerships that have helped your organization and your mission, what were the key ingredients in fostering that collaboration? And for, a nonprofit to employ in a collaboration, what are those key ingredients? And how do you navigate any challenges that may arise? Dr. Barnes, do you want to start us on that one?
Sure, happy to. I will share that unique in the philanthropic space, Episcopal Health Foundation has an engagement department, team, or division. And so we actually go out and we work with different nonprofits who are trying to work together to achieve a specific outcome and a specific impact. And the 4 pillars of that work we find are identifying a shared purpose. So every organization will have their own agenda, but coming together and identifying that place of overlap is really important. And then shared leadership, which is certainly easier said than done, but it is not having to call all the shots, but actually being open to multiple collaborators leading different aspects of the work ahead, and then agreeing on some strategic actions together, and then always having sustainability in mind at the start. And I think the collaboration that we had with the insurance companies that I described earlier really stood on those 4 pillars to move us forward to a place where we could work together and really start to advocate for change and for support from the state around non-medical drivers of health. I think when it comes to navigating challenges, you have to go back to your shared purpose and your shared leadership, and setting those norms up front, I think, is critical to being able to navigating sticky points that are going to happen along the way.
I agree with you 100%. And I would just say that, one of the things, first of all, I think we often take collaboration for granted. When you have a shared agenda, that helps. But I think it's also important to identify early what you're not agreeing to do, because that's where the sticky points come in. And I completely agree about shared leadership and the opportunity to share resources, but also the real points where you can share credit, right? Every organization is trying to raise awareness about what it does and move its agenda along. I firmly believe that we are some of our parts, and often we can achieve so much more together than we could do by ourselves, but it's infinitely easier to work by yourself, right? And so when we don't create the time and space and really honor the fact that time is required for collaboration, we kind of set ourselves up for failure from the beginning. So well said, Dr. Barnes.
I'll add just quickly, I agree with both of what Dr. Browne and Barnes has said, but in a government public-private partnership context, it's really important to recognize the difference in those 2 organizational cultures. Government has a very specific organizational culture for a number of reasons, being that, the mayor is elected by the people, it's hierarchical, there's a, very specific way things get budgeted. Nonprofits are much more focused on the ground, they're people-based, they're about different individual needs and personalities, and so recognizing that those 2 things are sometimes in opposition is really important, and building in really strong communications infrastructure that acknowledges those organizational cultural differences, right? So understanding that there needs to be kind of communication at, the senior leadership level, definitely mid, level management and frontline workers, to make sure the left hand knows what the right hand's doing and can coordinate on that partnership. So clear communication and understanding the kind of reality of different organizational cultures is really important.
Well said. It's been truly wonderful to have you all on the show today. As we wrap up our time together, is there anything else that you would like our listeners to walk away with today?
We can all make an impact.
Absolutely.
I would say that collaboration is essential as we look to impact really complex problems in our world. No one organization can do that alone. So working with other like-minded people and organizations is really critical for us to move the needle.
And I think it's been sort of alluded to, but maybe not directly said, right? As leaders of not-for-profits, we definitely need to be focused on collaboration because it could lead to greater impact. But there's also the beneficiaries, constituents. And I think it's really important to make sure that in our case, Ronald McDonald House, that families have the input in everything that we do, right? They're the organizing entity for everything that we do. And for other nonprofits, take that into consideration when it comes to the populations they serve.
And I'll just add that conversations like this, right, where women are coming together and sharing best practices, talking about what the secret sauce is that makes their organization work is really valuable. So I'm grateful, we had the chance to come together, and I would advise folks seek out other leaders, have a cup of coffee, grab lunch, and just, share your challenges and try to workshop those challenges together. Because more likely than not, if you're going through it, somebody else is going through it too. So there's strength in folks coming together and supporting each other.
Spotlighting the incredible work that each of you are doing. And as 2024 Social Impact Women to Watch, it's been a great honor for us as Nonprofit HR. And I'm certain our listeners will feel as energized leaving this conversation as I am. So thank you.
Well, that's our show for today. One of my favorite parts of this conversation was hearing about how their missions have been pushed forward through collaboration, and not only internally with employees and stakeholders, but also with external partners who share a similar mission. We really appreciate you listening to The Switch, and if you're looking for more episodes, visit nonprofithr.com/The Switch. There you can access recordings and resources to help your organization maximize its greatest asset, your people.